Ruth, and I'm going to say a little about the Miscarriage Association, about miscarriage and about the other kinds of pregnancy loss that we talk about in our organisation. The Miscarriage Association is a charity, and we offer support and information to anyone who needs it, and that's about miscarriage or two other kinds of pregnancy loss. One is called ectopic pregnancy, and the other is called molar pregnancy, and you might not have heard of either of those. I'll say a bit more about each of those kinds of pregnancy loss. So if we start with miscarriage, what happens in a miscarriage is that the baby either doesn't develop or doesn't develop properly and dies inside in the uterus in the first 23 weeks of pregnancy. If it dies after 24 weeks of pregnancy, that's called a stillbirth. Sadly, miscarriage is horribly common. Around 1 in 4 or 1 in 5 pregnancies ends that way. And most of them end in the first 12 or 13 weeks of pregnancy, but quite a lot of them, or a smaller number, but still quite a few, will end later on in the pregnancy, perhaps when people think they're past the danger time. Most people who miscarry once. Quite a few of them will miscarry more than once, and they might have healthy pregnancies in between. About 1 in 100 people will have what's called recurrent miscarriage, miscarriage after miscarriage after miscarriage. People often wonder why miscarriages happen, and the answer is we don't really always know, but we do know that most of them happen because something has gone wrong in the very early development of the pregnancy. And that tends to be because of chromosomes going wrong. So chromosomes are the kind of building blocks that we all need in order to develop. If there's a chromosome problem that causes a miscarriage, it tends to be a one-off random event. It's not necessarily something that's going to keep on happening. That doesn't make it any less upsetting, though. There are other causes of miscarriage too. Sometimes it's illness or infection. There might be other problems with the mother's health. There might be problems with the baby itself. But in many cases, people never find out, they never know why they've had a miscarriage. People worry quite often that it's their fault, that it's something they did or they didn't do. That's really, really unlikely to be the case. We know that even if people do all the right things, all the things that you're advised to do in pregnancy, you can still have a miscarriage. It can feel very unfair. So ectopic pregnancy, around 1 in 80 pregnancies is called an ectopic pregnancy, and ectopic just means it's in the wrong place. Instead of starting to grow inside the womb, which is also called the uterus, it starts growing sort of on its way there. And it can't survive. Either there isn't enough room, especially if it grows in one of the tubes, or there isn't enough of the kind of nourishment that it needs in order to develop and survive. Ectopic pregnancy can be a risk to the woman. She might need an operation, and it can be very, very scary. A molar pregnancy is something that very few people have heard of. Around 1 in 600 pregnancies are molar pregnancies. And what happens here is that there is something wrong with the very early beginnings of the baby, and the baby cannot develop, but pregnancy hormones do develop, and the womb or uterus keeps on preparing as if a baby is developing. That kind of pregnancy loss usually needs an operation, and then also follow-up. So doctors need to keep doing tests to make sure that it doesn't cause more medical problems later on. And I think what's important to know is there is more information on our website about miscarriage and about ectopic pregnancy and about molar pregnancy. I think it might be helpful to say something about feelings. Everyone's different, of course, but lots of people have really difficult feelings around miscarriage or ectopic pregnancy or molar pregnancy. And I'm going to start just saying miscarriage to sort of include all three. One of the things that people find really difficult is that whatever they are feeling, they often say that people around them don't understand. They really don't understand what they're going through, and they often try to cheer them up. I think sometimes when somebody else is upset or sad, that's what we try to do to make them feel better. But it can make you feel that nobody's really listening and nobody's really understanding. So what sort of feelings do people have? Well, people describe all sorts of things. Very often the first thing is shock. They're shocked when they're first told there's something the matter, or they're shocked when they see bleeding. And they might also be shocked at the amount of pain and bleeding that they have when they have a loss. Some people sort of accept what's happening. They see it as one of those things and they're not terribly distressed or upset. But for a lot of people, there are really strong feelings of sadness. They may cry a lot. It doesn't necessarily make a difference if it was a very early loss or if it was a later loss. They still feel very, very sad, and they may grieve. They're thinking about what they were waiting for, the kind of hopes and plans that they had for their baby. Quite a lot of people say that they feel angry. Why me? Why not other people? How come other people don't seem to have any problems? Sometimes they feel guilty. Is it my fault? Is it something I did or didn't do? And the answer is almost always no. These things aren't really happening because of something you did or didn't do. But it's hard to believe that if nobody gives you an answer. Quite a lot of people say they feel empty. They also sometimes feel very jealous of other people who are obviously pregnant, or maybe they're carrying a baby, or they have children. People talk about being frightened. The whole experience can be very frightening, sometimes particularly in hospital, where you don't really understand what's going on or what's going to happen. And people are frightened about what's happening right now, and also about what it means for the future. For some people, miscarriage can affect their mental health. They may find that they are more depressed, that they have really strong anxiety. And it can affect relationships too. It can be tricky if there is a couple and one of them feels very differently from the other. So that can be a tough time. People often have lots of questions. They've got questions about what's happening now and about what's happening next. They often ask us to explain words that staff have used, and particularly in hospital or even with the GP. Sometimes they are words that you've never heard before or that you just don't understand. So it makes sense to ask the question. And they sometimes ask us to help them make decisions. There are some times in miscarriage or ectopic pregnancy or molar pregnancy where you are asked to make decisions, and it can be difficult to do that. It can also be hard to take in information when you're upset. And for some people, it's even harder to understand. For example, if you don't speak English, or if you're deaf, or if you just don't understand what's being said. And it's difficult to remember things even if you understood them when they were being said. People ask us, why am I feeling this way? Is it normal? And that's because others seem to suggest that they shouldn't have these feelings. They should just cheer up, that they shouldn't still be feeling sad. We can often help by just explaining that whatever they've been through, whatever they're feeling, there will be other people who feel very much the same way. It's understandable. We also quite often do a lot of explaining. We explain whatever we can. We're not doctors or nurses or midwives, but we can often explain what people have been told. And we might also suggest questions that you might want to ask your doctor, or we might want to suggest where people might be able to find extra help. For example, if they need professional counselling. So here's our website. We have lots of information and lots of support here, and also lots of stories where people have talked about their experience. I do hope that you'll take a look around and that you find it helpful.